the previous studies and our experience with Presbyond and laser blended vision. This being a relatively very new modality of treatment, there are very few published reports regarding this. We have a couple of papers by Dan Reinstein, who is the pioneer of Presbyond, another published report by a Switzerland-based group, and our own publication. So, coming to the pioneer Dan Reinstein's results, in total, when he published it, he had 136 myopes, a fairly equal number of hyperopes and emmetropes. He had placed the target refraction for distance at plano, and depending on the patient characteristics, the near eye was corrected to minus 0.75 to minus 2 diopters. His level of treatment was myopia up to 8.3 diopters and hypermetropia plus 5.75 diopters. 98% of the myopes gained 20/20 vision, 86% of the hyperopes got 20/20 vision, and 92% of the percent of emmetropes got 20/20 vision. Near vision of J3 was seen in all eyes. J3 is equal to N8, J2 in 91% of the eyes. When both eyes were taken into consideration, 20/25 and J2, 94% was achieved in the myopic group, 92% in the emmetropic group, and as expected in the hyperopes, it was 80%. If you remove the hypermetropic group and consider only the myopic and the emmetropic group, the monocular uncorrected visual acuity was 20/20 in 99% of his patients and 20/32 in all of the patients in the distant eye. The uncorrected near visual acuity binocularly was J2 in 96% and J5, that is N10, in 100% of his patients. Binocular and uncorrected visual acuity was 20/20 and J5 in 99% of his patients. Regarding the stereo acuity, 68% had 100 seconds or better, and 93% had a good functional stereo acuity, that is 200 seconds or better. The spherical aberrations, he studied them and saw that in the myopic group, an average of 0.20 microns of positive spherical aberration was induced. In the hyperopic group, it was a negative aberration of 0.32, and in the emmetropic population, in the near eye, minus 0.23 of negative spherical aberration was induced. There was no change in the contrast sensitivity across all frequencies. Other observations were that binocular uncorrected visual acuity is more than the uniocular distance visual acuity. This is a very key point, binocular uncorrected visual acuity. And in his group, 30% of the patients needed a retreatment. Now, he was the pioneer of the study and he was just building it up. These are all his initial patients. His criteria for retreatment was also very stringent. He would retreat the patients if their distance vision was worse than 20/25 or their near vision in the near eye was lesser than N10. Coming to the results of the Swiss group, they have done around 1,500 eyes plus eyes till date. However, their publication is only on 60 patients, that is 120 eyes. Their uncorrected distance visual acuity was 20/25 and near vision J2 in 100% of the myopes and emmetropes. However, the hypermetropes had only 68% of this target refraction, that is 20/25 for distance and J2 for near. All emmetropes were 20/20 for distance and J2 for near. Safety is also demonstrated in their study. No patient lost more than 2 lines of best corrected visual acuity. 99% of their patients tolerated the micromonovision created. Their retreatment rate was similar to a regular LASIK of 6%. Their criteria are of course little lesser than Dan Reinstein. Coming to our study and our results, we have till date treated around 196 patients. The publication is on the first 100 patients. These results are again 150 patients who have completed 6 months follow-up. The remaining patients are yet to complete 6 months follow-up. So if you can see here, the visual acuity, this is in the distance eye, this is in the near eye. I'll blow it up a bit. So in the distance eye, 68% of the people have 6.6 or better. This is only in the distance eye. When you go to the binocular acuity, 100% have 6.9 or better. 6 by 7.5 or better is seen in 89% of the patients. In the near eye, 618 is seen in 75% of the patient. This is the near corrected eye. The near corrected eye also sees 618 or better. We induced minus 1.5 of micromonovision in most patients. In an older age group, we had increased it to minus 1.75. Despite that, they would read 618 or better. A few of the patients, that is in the patients we had induced 1.75, could not read 618. The same chart again. So near vision was much better than expected. For in the near vision eye, it was much better than expected. None of our patients needed enhancement procedures. Adaptation, as Dr. Smith has already said, myopes adapted very well. Within 1 month, they were very happy and doing all their reading activities. Hypermetropes and emetropes, and also the younger age group who really haven't experienced presbyopia, they would take longer to adapt. 3 patients complained of occasional cross blur with 2 eyes open for distance. However, they improved with time. So the ideal time frame we would propose is just counsel them to wait for around 3 months. By then they come back saying yes, they are happy then. A few patients also complained of night vision symptoms, but they all improved after 3 months. The safety of our study, no eyes lost more than half a Snellen line. Very few letters were not read by them. To summarize, this laser blended vision and presbyon is the patients adapt to it very well when compared to regular monovision. As we have shown that it is quite a safe procedure, none of our patients lost more than half a line. We have not treated more than +3 diopters. Our extent was +3 diopters. This is from Dr. Diane Reinstein's study, plus 5.75, and he has gone up to 8.5 diopters in the myopes. All our patients had very good intermediate and near vision. There were no problems with contrast or night vision problems. Thank you.